Hello and welcome to another lecture from the Jekyll textbook on epidemiology, biostatistics, and preventive medicine and public health. In this lecture, we will give a good overview of public health as it relates to public health definition, health in the United States, talking about the major sources of mortality and morbidity, understanding the actual causes of death, looking at metrics such as disability adjusted life years to calculate, for example, the burden of a disease or a death. We'll also look at, spend some time on the data sources in public health. If you remember taking surveys in elementary school, you might have taken the Youth Behavioral Risk Factor survey. And then as adults, you may also have a chance to kind of also take additional surveys given by the government to assess the health of the nation. We'll look at injuries as a concern for public health. It definitely directly affects pharmacy practice, as pain medication is used as a form to combat the pain associated, the physical pain associated with injuries. And then we'll look at finally the future trends in public health. What lies for the future of public health? And obviously, I'm a little bit biased, having a public health background, and I think that this is a great and exciting field, and it's not only developing, growing, but I think it's definitely an exciting time for pharmacy and medicine and other allied healthcare professionals to work collaboratively and interprofessionally in combating diseases, disorders, injuries, and other environmental health problems. We start out with, answering the question, what is the meaning of public health? So one is that public health is the health status of the public. What is the overall health? And there's obviously physiological metrics. There are surveys that can be taken to assess the quality of life. Some of you who've had a chance to hear my lectures in economics, we tend to survey patients who are undergoing a cost utility analysis. We would try to figure out their quality of life by directly asking them through surveys. The other second meaning is related to this organized social effort to preserve and improve the health of the population. And you can see the quote or the definition by Dr. Winslow almost a decade now. And this amazing definition still definitely holds true today. If you read it, you'd think that it was developed just recently. And then more recently, the public health associations have come up with what are the essentials in public health surveys? There are 10 essential public health services, and they're basically grouped into these three areas: assessment, policy development, and assurance. And if you study public health long enough, you will have a better understanding and be more ready to utilize. Well, how do you assess a population for health? And as a result of those metrics, you would then, if needed, what are the important policies that need to be made by decision makers so that we can act upon the assessment. And then finally, assurance. Are you making sure that you're measuring what are the new outcomes of these policies so that to answer the question, is the new policy worthwhile? Was it a good one? I think it's important to articulate some of the great achievements in public health. The list here alone has contributed more significantly than medicine or pharmaceuticals. Obviously, vaccine is pharmaceutically related, but in general, public health has kind of taken ownership on giving the extended livelihood and the extended quality of life of not only Americans, but those worldwide as a result of improving public health through these areas such as vaccination, obviously to combat infectious diseases, and then areas such as improving car safety, occupational health, so safer workplaces. As I mentioned, control of infectious disease would be related to vaccinations. And then combating these chronic diseases in cardiovascular disease, for example, with from statin drugs to obviously education to improving nutrition and physical activity, to understanding what are the risk factors in these areas to control for the burden of cardiovascular disease. Obviously health promotion, so safer, healthier foods and nutrition, child maternal health, family planning, fluoridation of drinking water. So thinking of oral health and how that has dramatically improved over time by a elemental chemical such as fluoride. And of course, the recognition of tobacco as a health hazard, which is, if you know me, this is one of the areas of my research. So the US, and in particular the CDC and the National Vital Statistics Survey, that is, again, housed and conducted by the CDC. We need some of these metrics to tell us how long are we living, what is the infant death mortality, and if there's death, what's causing it. And so you can see by this table, just in recent years and plotted over time, the life expectancy in years at birth and at age 65, and then calculating the number of deaths per 1,000 live births, which indicates the health or the work that's being done at the child and maternal medical care level within and between countries to assess for the importance of obviously child maternal health. And then when we are developing policies and resources in public health in terms of which diseases to go after, we know that heart disease is a leading cause, as well as cancer, stroke, and then more recently the growth of respiratory diseases have arisen quite dramatically. And unintentional injuries, again, causing physical pain, physical disability as a result of motor vehicle accidents, as well as other types of unintentional injuries, cause quite a significant burden, morbidity, and mortality. And then diabetes, as some of you are well versed in the epidemiology of diabetes, because again, this is another leading cause of disease that is in nature chronic. How do we measure the burden of a disease? Well, there are various ways. One way that again is calculated as a result of the national survey by the CDC, we can calculate, for example, years of potential life loss. So this is a way to measure or account for the impact of mortality and premature death. We can kind of, because we know how long we're supposed to live, and now we have data on when you die, well, that period in between are basically years of potential life lost. In a death certificate, we want to record what is actually causing the disease, right? This is a very important metric in terms of understanding what is causing the disease. Well, we mentioned in the previous slides what some of those common diseases are, and we want to record them. And so there's a way to consider what is the leading cause of death, and by noting these, we will be able to understand some of the what we call upstream determinants. Basically, we would be able to tease out some of the risk factors causing some of these diseases. Another measure is a DALY. This is a disability adjusted life year, which captures the length of life lost due to premature death. But we also can account for the time spent in poor health. So if we know that there is morbidity associated with a disease, that morbidity can be accounted for in this DALY. And we talk a lot about decreasing mortality or morbidity, but public health is more than that. So I think it's, again, kind of an exciting area of public health. To me, it's also looking at some of the disparities that can occur as a result of socio-demographic factors, by race, by sex, by income. And this is good evidence that shows racial as well as gender disparities in life expectancies between Caucasian and African Americans, for example. Again, there are other areas of disparities as well, such as access, utilization, cost, quality measures, and health outcomes. All have, those of you who have taken my economics class can hopefully appreciate the disparities that occur in those areas where public health and health economists and epidemiologists, as well as the entire healthcare team, can come together to provide some innovative solutions. Speaking of those other areas of disparities as far as access, cost, quality measures, and health outcomes, just like in economics where we do a cost effectiveness analysis or cost benefit analysis or cost utility analysis, there's an equation, and that equation usually requires this ratio where there's a numerator and a denominator, so we can measure and account for a rate, right? So a rate gives us a value so that we can compare groups. We can, in public health, we can compare treatments, we can compare communities, we can compare states, we can compare policies, we can compare services. So in the next few slides, we're going to look at what are some defining events in the population, such as births or deaths, and this would be in the equation would be in the numerator, for example, and then in the denominator would be, for example, the population at risk, right? And we would get this data through data. You can think of the numerator or this equation when you look at it, the prevalence or the incidence of a disease. Basically, in a nutshell, this is a broad look at a ratio or a rate so that we can obtain metrics associated with a disease, for example. So obviously why is this important? It would be to spur change and provide accountability to allocate appropriate resources, make appropriate policies to, again, counter the public health threat or issue. And health indicators should not measure not just the disease, but also health equity, social determinants. There are other social factors that mention health, gender, income are just a few, the quality of life, and then considering the entire healthcare system's performance from not only the provider, but the payer, but the patient as well. And this is showing a schematic that gives us a little bit more detail in terms of how the public data sources would look like. In the numerator, our data sets and surveys. I mentioned the US Vital Statistics System conducted by the CDC. Also, that would give us, the CDC also helps with gathering leading health indicators. There's also a National Center for Health Statistics under the NIH that helps to also gather and accumulate health statistics at various levels, from health systems to local community level statistics. I've mentioned other ongoing national surveys like the Behavioral Risk Factor Survey. There's also something called the NHANES. We'll look at that. Other notifiable diseases, meaning some very specific surveys as a result of specific diseases such as cancer, diabetes. These data are very specific and can be housed in certain registry, we call registries, and other health of special populations as well. The denominator we need, because we need to know what is the total, who is involved, and it would obviously give us a rate. And there are other data that are related to environmental injuries or occupational, as well as scorecards or benchmarks from health systems and international data as well. More data that gives us not only varying perspectives, but a unique perspective on the health status include surveillance, public health surveillance, again, surveys at the local, state, and national levels that might be related to health surveys, again, health surveys like the Behavioral Risk Factor Survey and NHANES registries, cancer registries. The textbook talks about the SIR survey that's associated with cancer. Again, obviously there's others that are associated with diabetes, respiratory, and other chronic diseases. Health informatics is an important area for gathering data at the institutional level, and with electronic health records, that is obviously giving us a clearer picture at what's happening at the institutional level within clinics, for example. The EPA, the Environmental Protection Agency, and states themselves gather quite a bit of evidence and data on the environment, on monitoring toxic chemicals, for example. And then all this that's provided to researchers can definitely inform not only the public, but again, decision makers at the government, as well as the industry level. So many sources from local, state, federal levels that are used, again, to measure burden, to educate and inform the public. guide and develop priorities, acquire resources. For perhaps a state has an excessively high prevalence of a chronic disease, and they may ask government to help them fund programs and research related to combating that particular problem. Develop policies, plan, implement, and evaluate programs, and then provide a basis for research. And this is actually related to those 10 essential public health services that I mentioned earlier in the lecture. So plenty of national data sources on health and health determinants. It is one thing that's great about, I believe, our government is that it does do its due diligence on accumulating data pertaining to our health so that we can provide appropriate resources in combating that next chronic progressive epidemic disease. You can see this in this table. This is just showing various surveys associated with measuring health outcomes. I've mentioned two of them to you, and the Behavioral Risk Factor Survey System and the National Health and Nutrition Examination Survey, otherwise known as NHANES. The BRFSS is particularly administered only to adults, which assesses health-related quality of life, health conditions, use of recommended healthcare services, behaviors such as smoking and nutrition, as well as what is their access to care. What's different with the NHANES is that it'll look at chronic diseases, mental health, oral health, but it combines physiological measurements. So there's a diagnostic component to this survey, which kind of gives it that extra layer of validity in a sense. So measurements of blood pressure for hypertension, measurements of serum cholesterol for example, hyperlipidemia. As mentioned, the environmental health concerns are of importance, so there will be environmental health surveys along with some environmental health surveys or social surveys, and one that is particularly important is this American Community Survey. So when researchers conduct to do analysis of those health outcome surveys, they may alongside correlate and use the American Community Survey to look at the population and demographics impacted by those diseases. So you can kind of think of utilizing the American Community Survey as the denominator when conducting an assessment, and those health outcomes data would be the numerator, for example, when looking at a research project. Again, the physical environment that is utilized to assess air quality, indoor and outdoor, as well as understanding toxic elements as well. Data sources on prevention is very important because we realize that as a way to combat cost, as a way to address disparity, we're going to have to be conducting and become more educated and be innovative in the way that we are doing prevention. So there are various organizations that you can see listed here that are involved in evaluating the quality of our healthcare to obviously conduct improvement measures, but more importantly, to conduct preventive services, preventive medicine, and preventive scientists to nip the problem right at the beginning so that it doesn't progress and become a chronic disease over time. So this is kind of to orient you. Remember our lecture on primary, secondary, and tertiary prevention. You know, prevention on and a focus on primary prevention would focus on health education and on policy making, for example. Internationally, the World Health Organization, as well as the United Nations and the Commonwealth Fund, and these other, the European institutions, the Organization for Economic and Cooperation and Development, as well as the European Union, they are also involved in gathering health outcomes and conducting their own surveys, as well as countries reporting to these agencies so that we can have proper surveillance and proper epidemiological work to conduct health promotion as well as health prevention. I mentioned injuries as a source of burden, and it's important to look at injuries because they are a leading cause of years of productivity, life years losses in the United States before the age of 65. Its intentional injuries exert, it's a major concern to the young. And if you look at broken down into various activities, so homicides possibly caused by guns, and the homicide is the number 3, 4, and 2 cause of death for these categories of ages in children. So injuries can again range from homicides to home incidents related to falls, burns, poisonings, automobile crashes, work incidences. Miscellaneous include plane crashes, building collapses, so things that are environmental could also be part of the miscellaneous. And thinking about behavioral health, mental health is suicide. Can suicides be prevented by appropriate mental and behavioral interventions? I really like this matrix because it tells us the injury, that in an injury there are 3 phases. There's a pre-injury phase, before the injury happens or occurs. There's the actual time that the injury occurs, and then there's a time that the injury occurs. So this is the post-injury. So in this time period, there are risk factors. There are 3 main risk factors associated with these injuries, and how categorizing these risk factors, whether it's human, so the person themselves can be a risk factor. The car or van that they're driving is considered a risk factor. The physical environment is a risk factor. And one thing that we'll add here in the physical environment is we'll put in the social environmental factor. So you can see how in each phase and with each respective risk factor, there is some program, there is some service, there is some policy, there is some device, there is some kind of vehicle manufacturing innovation that could be incorporated. There could be laws, physical improvements to roadways, and thus enhancing the environment to avoid injuries that could attribute to improving the rate of injuries as a result of vehicular accidents. And why I like this is that we can also transpose this matrix to other injuries. Perhaps we can also transpose this to other diseases and burdens, in cancer, in diabetes. So to wrap things up, the future, again, I think is bright in public health. And there's going to be improvements and a focus in many of these areas, from informatics to more holistic approach of health, emotional, the environment, to access, to mapping with respect to better surveillance system, because we were able to visualize and act and be able to obtain real world and real-time data to address an epidemic. And as pharmacists, the area of genomics, I think that we all understand the importance of personalized medicine, and pharmacogenomics kind of go hand in hand, and how this area can vastly improve pharmaceutical targeting and medical care to be more personalized, be more pinpointed, to be more targeted at that particular disease. And then I think all this would kind of lead to innovations in other areas, such as administration, as well as non-traditional areas as well. For example, looking at data that is within the K through 12 system of education. So to summarize, we have now gained a greater appreciation of various sources of data to analyze health-related rates and risk. Again, this kind of forms our equation to demonstrate value when you're looking at various denominators and numerators within the data. So in the future, I believe that mapping and technology, as well as connecting between search data as well as real-time reporting, as I just mentioned, will really transform the field. If you have been following health informatics, we know that kind of the buzzword right now is big data, assessing big data, doing research on big data. So I hope you found this lecture to be very big, quote unquote, and be very informative, and look forward to continuing this sort of research and teaching with you. So good night, good evening, or good morning.